The COVID-19 pandemic and the restrictions put in place to try and stop it have had a negative effect on people's quality of life in South Korea as elsewhere. And a new report shows how big of an impact it's had. Social engagement is down dramatically, causing people to feel more isolated and less trusting. More people are also now overweight. Rae-hyun tells us more.
New data shows the COVID-19 pandemic has led to more loneliness and social isolation in South Korea. According to Statistics Korea's annual report on the quality of life released on Tuesday, the social isolation rate was higher in 2021 than before the pandemic in 2019. Asked whether they have someone who can help do house chores when they get sick or someone who they can talk to, 34.1% of respondents said no, an increase of 6.4 percentage points from 2 years earlier. People also viewed others as less reliable or trustworthy. The proportion of respondents who said they trust other people fell by almost 16 percentage points in 2020 to 50.3%. This reflects the anxiety caused by restrictions of in-person activities amid COVID-19. South Koreans were far less active in 2021, only taking part in an average of 4.5 culture, leisure, or sports activities in that year, around half the number that people did in 2019. Along with a decline in leisure activities, the survey also showed more people are overweight. 38.3% of the people surveyed were overweight in 2020. That's an increase of over 4 percentage points from a year earlier. The agency said this increase is related to social restrictions on public facilities.
As physical activities tend to decline, with more people working from home and the closure of sports facilities during the pandemic, this may have led to more people being overweight.
Meanwhile, trust in authorities, including the government and medical industry, jumped to 47% in 2020 from a year earlier, with trust in medical organizations at 71%. The official says the government's early response to COVID-19 has contributed to those high levels of trust in 2020.
When the pandemic started in South Korea, the government managed to establish public health measures quickly compared to other major countries. That's why trust in the government, educational, and medical organizations rose by 9 percentage points.
He added more policies to encourage social engagements are needed to reduce social isolation and improve people's fitness. Rae-hyun, Arirang News.